Hello, everyone. Welcome to another episode of the Healthy Perspective podcast. Today, we have yet another chiropractor on with us, and it pumps me up being able to talk with other chiropractors, being in practice with another chiropractor, and then talking with other doctors of chiropractic that are doing more than the adjustment. I love being able to refer to other chiropractors, like we were talking kind of pre-recording, because I know we have the same philosophy, even though we might have different practice styles. Our goal is to get people healthy, get rid of chronic disease, independent of the medical system. And Dr. Jessie is that. Dr. Jessie Hehmeyer is a physician founder of Well Empowered, where she practices data-driven, outcome-oriented functional medicine. She created Well Empowered with one commitment in mind: guiding you to create the health and vitality that transforms your experience of life and alters what is possible for you. She takes the root cause approach with natural medicine, and she works with one-on-one, with groups, or in delivering corporate webinars. Dr. H provides information, inspiration, and strategies needed to produce sustainable and transformational outcomes. Dr. Hehmeyer, thank you so much for joining me.
Thank you, Dr. Chris. It's such a pleasure to be here with you and your tribe.
I'm happy to bring you here. I mean, I always love, like I said, bringing on other chiropractors, but seeing what chiropractors are doing, more than just kind of the bare bones that we learned in school. Also being an entrepreneur, like you've mastered, certain parts of it that some chiropractors never get the opportunity to master. So I think this is going to be a really powerful call from health to entrepreneurial life, and I'm excited to dig in.
Awesome. Me too.
So why don't you kind of just go back, from the beginning. You're a high schooler, or whenever you were interested in a postgraduate study. What kind of made you choose chiropractic, and what was your evolution from more of an adjustive chiropractor, physical medicine, to more of what you do with functional nutrition and whatnot now?
Yeah. So, I always say straight lines are boring. And so for me, you're right. It did actually start in high school, but for me, it started in high school. I grew up dancing and I spent a lot of time dancing. And so, with anyone who moved a lot or does move a lot, things happen to the body here and there. And so when I was in high school, my mom would always take me to the chiropractor as needed. And he always made a huge difference for me. It was like night and day. And I remember being in college. I went to UCLA undergrad, and I remember once I was a big runner at that time, and I had what I now know was sciatica. Right at that time, it was just like severe shooting pain down my leg. I didn't have a name for it, and I limped about, wishing it away for a couple of weeks, and then that didn't work. So I found a physical therapist because I just didn't know what else to do. I looked it up in the yellow pages back then, right? And he was very, very kind, and I, it was a decent bill, but it didn't make any difference. And then ultimately, about a week later, I went to a chiropractor, and after the treatment, I was like walking out doing cartwheels, ready to cry with joy,
Wow.
right? And I know you've seen that in your office, right? That just boom. It was just
Of course.
wow. So,
Right.
out of college, I actually first stepped into the world of fitness, and I got 7 different certifications, and I opened up the first high intensity strength training gym in Chicago. It was still there to this day, called
Wow.
Lady Ride Super Slow. And after about 4 years of that, I sold my half, knowing I wanted to learn more and elevate my ability to contribute to people. And so I did look at different options in the way of grad school, but ultimately kept going back to what made the biggest and really, transformative difference for me at different times in my life. And so I landed on chiropractic school. And, kind of midway through our 4-year program, I really had this aha moment that I could shift the trajectory of my education and emphasize functional medicine, emphasize more of a kind of like a natural internal medicine approach. So I veered a little bit more towards, botanical medicine courses and things like that. And ultimately completed my chiropractic degree, and towards the end of it started a master's of science in nutrition and functional medicine. So since
Because you didn't have enough school.
yeah, no, I was like, oh, let's do more. Let's do more. Student debt is so
My
fun,
gosh.
and sleep, all nighters, sign me up, right?
So you had your bachelor's.
Yes.
And then you went to chiropractic school,
got my
and then
doctorate,
you decided to get your
and then I got
master's.
my master's. Yeah, yeah, yeah,
Oh my gosh.
yeah, yeah. But so I've never done what you do, right? I've never done hands-on physical medicine.
Oh,
Since I
wow.
started practicing, I went straight into functional medicine.
Wow.
Yeah, yeah. So I mean, I love and refer people to physical medicine chiropractors all day long, and I just found that for me, this is where I'm supposed to be.
That's amazing. I love it. And and I love how there's that perspective of like, this is what I want to do. I feel like that's so much better than people. Like, I've had people in second year in chiropractic school that had never been adjusted before, which is okay if you don't plan on practicing physical medicine. But if you have no idea what you want to do after school and you don't even know, like, it's like, what in the world is going on? So that's amazing to have a niche and a passion and a purpose, that didn't have to fit in the round peg that they give us. Like, this is what you do. These are the techniques. This is how you market.
Yes, absolutely, absolutely, and I agree. It's the joy and the thrill of learning. Everything we did in chiropractic school is tremendous, and it's a gigantic investment of time and
Hmm.
energy and money. And so, to step into that without really being sure of what you're getting, what you're up to.
Yeah.
I know I would have loved practicing physical medicine. That was my
Hmm.
intention. It's just that
Hmm.
along the way, I was like, well, this is even more aligned for me.
Yeah.
Right. So,
I love it.
yeah.
That's amazing. So you step out of chiropractic school, get your master's. What route did you take from there to start, reaching people and whatnot?
Yeah, so first I started working for a company. It was a company in Chicago that at that point they had two locations and they offered traditional chiropractic, physical medicine.
Hmm.
Um, and they brought in me to bring in the functional medicine aspect, and then they brought in another woman to bring in acupuncture, and then they started to grow. So they went from two practices, and I think when I left about 5 years after I started with them, they were at about 15. I'm not sure where they are now. And it was a
Wow.
really great place for me to start because I knew at that point out of school, I really just needed to continue in the practice of clinical skills, right? I needed just to be
Hmm.
focusing on that. But I also knew that in the future was opening my own business, right? I'd done it in my 20s and I loved that. And it was just, for me, it's where I bring my best to the game. And so after about 5 years of working with them, and they were a great group of people, we very respectfully and happily parted ways, wishing each other well. And then I went on to open up my business, and that was in gosh, I have to do the math here. I opened the doors in 2018, and at that point, they were actual doors, right? It was
Hmm.
in-person doors.
Wow. Wow. That's incredible. And so, uh, how did you start to begin? So did you like take people from that practice, or like how did you start to build,
No,
your
yeah.
yourself, your identity, and whatnot?
That's a great question. So, no, I'd signed a non-compete and worked with, a high degree of integrity with that. There were
Sure.
people who found me and
Hmm.
not at all through my solicitation. And my former employer was, very gracious about
Yeah.
that. And a few people did, but really mostly it was word of mouth, right? It was
Mm.
my work in the fitness industry and the people who knew me in the health world in that
Mm.
respect started to hear what I was up to. So initially it was very organic. Then I started to cultivate relationships with MDs who now refer to me. Another thing that I did is there's an organization called the Institute of Functional Medicine,
Yeah.
and you may be familiar with it, and some of your listeners may be also. Some of the big names at IFM are Dr. Mark Hyman.
Hmm.
There are a few people, and he's one of the people who's really at the forefront of the IFM organization. And so, one of the things that he'll do that I'm very grateful for is in his education, he'll encourage people to go find an IFM certified practitioner, and I am an IFM certified practitioner.
Gotcha.
So people will find me that way also.
So if people are, unaware, I mean, functional medicine, I feel like is becoming more and more popular, and probably more importantly, more and more available. And maybe the two, uh, funneling each other really as becomes more available, more and more people are using it. For people that might not be, aware, maybe have only done chiropractic or only done, doctor, that, whatever. What is the practice of functional medicine like? How is it different from going to, a standard medical office, medical visit, and whatnot?
Yes. So one thing I'll say is another way of saying functional medicine is I like to call it data-driven natural medicine. And if we take those words and break them down, on the data-driven part, this is kind of like how we solve the problem, right? I get a lot of information seeking to understand what is at the root cause of this person's symptoms or condition or health conundrum, right? And that information is a combination of what I can only learn through a conversation, right? A 90-minute conversation for a first appointment.
Wow.
And also pretty extensive tracking people engage in, that it's a real-time live shared tracker so that I can pop in and out of it at any point and notice where symptoms are showing up in relation to nutrition or sleep or movement or all those different things. And then, the data in the way of numbers comes from labs. And I gather a lot of data on people. So,
Mm.
when I send people to go get their labs done, I'd let them know, I would like you to relate to this like you're giving blood, because it's a lot of information. And there's, the whole world of quote unquote standard lab tests, but then there's a whole world of specialty lab tests. And I'm sure, a lot of your listeners are familiar with these, the food sensitivity tests and the adrenal and
Mm-hmm.
sex hormone assessments and the microbiome assessments and all those things. And so really through putting these puzzle pieces together, and first of all, really just figuring out what are the missing puzzle pieces, because not everybody needs every test, right? We want to be
Yeah.
targeted in our approach, but getting that information lets us craft the path ahead with the natural interventions, and the natural interventions being nutritional, supplementation, lifestyle. And then, by the way, over time, as the body starts to heal and symptoms start to resolve, and people feel great and they look great and they get what they came to get, we do retest those numbers again to check our work, right? Because that will
Mm-hmm.
also inform our path forward. Okay, a certain amount of healing has happened. Let's get rid of that
Mm-hmm.
supplement. You don't need it anymore,
Mm-hmm.
right?
Mm-hmm.
And so we, we're in that journey of healing together.
Yeah. I love that, and that's such a different approach, like you said, than a medical doctor. Where if you go in with constipation, they're probably only gonna like, let's look in your intestines and see if anything's blocked. Let's do a contrast X-ray to see, let's look and see if we see anything. When that's really yes, there could be something in there for sure, and that's not a bad screening. But if you don't see anything, typically it's like, take you some relax. Like, there's not really a more of a look, there. Or if you have headaches, like, okay, so, well, let's make sure you don't have a tumor. If you don't have a tumor, I don't know what it could be. And we're thankful for that, because we don't want to miss something that could be catastrophic or super, pathological. But what I love about your approach is somebody can come in with X symptom, and we're going to look at the whole array, because your hormones might be off, because your immune system is overactive, because your digestive system is not working right. And there's a gut brain connection there that then changes the way that your brain is expressing. So the symptom that you have could be 10 steps downstream from the root cause up. And you're only going to know that by looking at how the systems are working together.
Absolutely. So perfectly said. So perfectly said. And to your point, it's a very appropriate at certain times for people to do the x-rays and the imaging and, all that stuff. And also more often than not, fortunately, right, people are left with, okay, it's not something super bad, but
Mm-hmm.
I still feel like hell. These symptoms are still
Mm-hmm.
here. Okay, maybe now I have a diagnosis for it. Oh, you have IBS. Okay, but I don't feel any better, right? How about let's solve that IBS thing, right? And
Right.
so it's fun to work with people and like every day, what people share with me and the shifts that they notice, it never, the magic never ceases to amaze me. And I'm sure it's the same for you, Dr. Chris. It's like you do this healing all day long, and still every day it's like, wow, look at this amazing body. It's so cool.
I love it, and that's what makes doing chiropractic worth it. Because I mean, sure, you can make decent money, whatever, but it's really that going home thinking about the 5 or 6 patients where it's like, oh, I couldn't lift my kid and now I can. Oh, I couldn't poop without having severe pain, or like the things that we take for granted, and for them it's life changing, and it's amazing. I'm gonna throw you a bit of a curveball, so answer how you wish. Um, I don't know, being in practice every day, and I focus in kids, and so I kind of feel like I get a bit of a look around the curve at what might be coming, with our teens, and then our young adults as far as chronic disease and whatnot goes, especially with having been a couple years with COVID, where these kids have anxiety, neurodevelopmental issues, even though there's no known cause, like there's no I don't know, trauma, or other than chronic, emotional stress. The food changed, like the preventative medicine changed, all of that changed, with COVID. But it hasn't really been just the past couple of years, but we're seeing chronic disease become more and more and more common. It's never normal, but more and more common, right? I'm off the heels of a workshop that I did last week, and I told people, like, it's like over 43% of kids suffer from one of 20 chronic health diseases. And if an adult is on a medication, most likely they're on 4 or more, like not just one. We didn't reveal this to our listeners earlier, but you're over in Switzerland. How do you see kind of the difference of the typical American family, the food that we eat, the practices that we have differ maybe from some of the practices that you see over there? Because I think Switzerland, Denmark, like those countries over there are known for preventative and being relatively healthy, versus America is known for being more reactive. Like if you blow your knee out, like this is where you want to go get your surgery done. What are the differences that you're seeing from the past, kind of all the way up to now, it's contributing to this chronic disease? And is there anything that we can, do to kind of steer our health trajectory around?
Oh my gosh, Chris, that's such a great idea. That's such a great question, rather. I mean, there's so many layers to the answer. I will say,
yeah, we could talk for hours on that
really,
one for sure.
really. But in every day, I notice something new. But one thing I will say, and the pace of life they live here is so beautiful, right? It's like I constantly have to check my American aggression, that like get out of my way now kind of energy. I mean, I lived in Chicago for 20 years and LA before that, right? So it's like that city energy is just coursing through every neuron in my body. And it takes something for me to talk to myself and be like, whoa, chill. You really aren't even in a hurry for anything. It's kind of funny. So one is just this environment that we live in the US that is go, 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 more, more, more in every sense of the words, right? So that creates a level of baseline anxiousness that leads to people making choices to kind of soothe that anxiousness that don't align, right? That's one thing. The other thing that I will say is, along with this pace of life, I kid you not, stores close for an hour and a half for lunch here. I'm not joking. I went this morning, and got my hair done this morning, and there was a store around the corner. I was like, oh, I haven't been in there yet. I want to go in there, right? So walk up to the store, go to pull open the door. The woman looks out from the inside and she points at the sign. It's closed from 12 to 1:30 for lunch. I was like, of course, silly me. Who isn't closed from 12 to 1:30?
Wow.
Right? But it's like that all over the place. Everything is closed on Sunday. And I mean everything. Okay, some restaurants are open, not all. All grocery stores, unless they are within the Bahnhof, which is the train station, they're all closed. So if you don't have your groceries on Saturday, you go to the Bahnhof and get your groceries, which is fine. So just like the pace that they honor, and, they set aside time to actually sit and eat together. You do not see people walking down the street what's coffee in their hand. If they're drinking coffee, they sit and drink coffee, right? I
Wow.
mean, it's unbelievable. And also, Switzerland's also unapologetic about honoring the importance of financial security. So it's interesting that they've managed to honor both their commitment to financial security and their commitment to a beautiful life, like a well-paced life where people get to enjoy themselves. It's a tiny, tiny country. It's not that much bigger in population than the city of Manhattan, right? So it's very small. But there's a lot we could learn from them. And I
Yeah.
mean, in the way of, the types of food, definitely their food is higher quality. They do, I mean, Swiss cows galore, so they do have lots of cheese, but they're made from happy cows on a mountain and, nary a pesticide in sight, so
Mm-hmm.
they do so many things, with the idea of enjoyment and bringing joy and delight and nourishment, genuine nourishment, rather than just get it done. It's just such a
Yeah.
different environment.
And that makes sense, because kind of as I alluded to, like America is very, you're thinking one step ahead. You're not necessarily taking that one step ahead with the 15 step ahead vision. You know what I mean? Where it's like, family, you said it's small. Like most everybody probably owns their home because it's been passed down for generation to generate. Like, like you're kind of like in this familial business type of thing, where here it's kind of like dog eat dog. Like, I'm going to take my retirement money and do what I want with it. You start from fresh as things continue to get more expensive, and I'm going to eat, Burger King quick because I need to get back to work. And you as you don't budget your time, more and more things will continue to consume it. Same with your money. You make more, but then you start spending more, and it's a cycle of more, faster, 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 faster. When the only thing that can stop it is I have a place where I'm going. I have a plan. Like I have something that's valuable to me, that's important to me, more than just more. Like, you know what I mean? And I would like to think that, especially the guys and gals that are, working 6 hour 6 day weeks and 15-hour shifts and whatever, that they have the intention of wanting to provide for their family, and that this is a short hustle, and whatever. So I don't want to think that people are doing it with bad intentions, but they're doing it without a future vision. Like, what can we create that will give me the life that I want, rather than bowing down to somebody for a certain amount of years, hoping that chance comes. And I think that's what you did, knowing that I don't want to work for somebody else. Like I want to do my own thing. How can people get out of that? Because I'm sure it's the same philosophy with weight loss.
Mhm.
Like, okay, I'm going to do a juice fast for 5 days and lose a bunch of weight. And it's like, okay, well, then what? Not that that's bad, but then what? Like, you can't juice fast for the rest of your life. For people that are, the W-2s or the W-9s or, whatever, that just are stuck in this hustle, how do you start to develop a vision for what your life looks like? And how do you take those first, couple steps and moving in the right direction, um, without, in the sense, like going in a bunch of credit card debt, or like those sort of things.
Yeah. Well, I mean, to me, I think a lot about how people change, because so much about what I do is
Yeah.
ultimately people only get the outcomes they come to get if I can effectively guide them to
Mm-hmm.
change. And there's a
It's good.
partnership, right? I can't make anyone do anything,
Yeah.
but fundamentally, I think about the two most powerful motivators for any one of us in any area of our life, whether it's around our career or our health, or I would even separate finances from career, because there are plenty of people who
Mm-hmm.
make $500,000 a year are in debt. People do that, right? But whatever area we're in, the two main motivators are either the carrot dangling or the stick on the back. And usually it's a little bit of both, right? You spoke to the
Yeah.
carrot dangling and vision, right? And when I work with people, especially in this area of weight loss mastery, because I like I like you, Chris, am just like an absolute hard pass no to things that are not sustainable, right?
Mm-hmm.
And so walking people through a process where they actually get to stand in the future and tell the story of how would it be you in 5 years with this area of your health just handled. Whether it's your weight or your digestion or your hormones or the pain you're experiencing, right? What is it like in this future you intend? And they actually write that story, first person present tense. And then also we do the same exercise, but we say, okay, now let's have you tell that story, but it's a downward spiral future, right? And so 5 years from now, not only have you not progressed, but it's a downward spiral. What's that like? And that does help people get in touch with the suck and the joy, right?
Yeah.
And so, really just in any area looking at like, okay, is this really how I want my life to go? Because, there's nothing wrong with working for someone else. And, the periods of my life where I worked for someone else, two things I learned. One is I learned I didn't want to work with someone else, but I also, was able to come at it with a little more compassion, having first been on the other side, knowing what it's like to keep the lights on and grow a business. It gives a unique perspective when you've been on both sides of that equation. And certainly some people they love working for someone else. They don't want to deal with, all the things you have to deal with if you own your own business. And that's okay. We all should choose for some people, it's more of a stress to work for themselves, and others, it's more of a stress to work for someone else. And you and I know where we fall.
Yep, absolutely. I love that that contrast. Chapter in my book that I wrote about kind of crafting a vision. It's this paradoxical, and it's semantics, but words mean something, right? It's like you can either live life running from something, or you can live life running to something, right? If you're running away from fear, if you're running away from failure, you really have no direction that you're running, and you can find yourself off a cliff super quick because you're only looking behind you. You're not looking in front to where you're going. When you're running towards success, you are also getting further away from failure,
Yes.
or further away from fear, or further away from pain, but you actually are going to land somewhere that's sustainable, so you don't have to constantly be looking over your shoulder. The systems you have in place for your food, for your family, for your finances, for your job are going to continue to propel you forward, instead of taking shortcuts and then wondering, oh no, am I, it's that running towards success, whatever that looks like for you, rather than from, failure. And that's what I love about chiropractic. That's what I love about natural medicine. So I'm sure you learned it in chiropractic school, like the salutogenic approach. Like, let's look at how we build health rather than just take away disease, and I think that's what you kind of described the Swiss people do. Like, how do we build a lifestyle that promotes health versus in the United States? How can we have this hustle, 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 and then take adaptogens, or take, all these sort of nootropics, whatever, to keep my mind up with this unsustainable hustle? Why can't we just craft a lifestyle that we can kind of come to balance? And we can eat mushrooms, sure. We can eat things that stimulate the brain, drink coffee, those sort of things, but for the joy of it, not to keep up. So why don't you just plug a little bit of, like, someone's like, okay, I'm done running from being fat. I'm done running from being inflamed. I'm done running from disease. And I kind of want to approach health from a different perspective, knowing that I'm not going to get this with the Western medical system. They're a pathogenic approach. They're going to find disease and want to take it out. I actually want to support my system. What does it look like to call somebody like you and jump on a consultation? And what does the process, kind of look like after that?
Yeah, well, so yes, to your point, it starts with a consultation, right? A 30-minute complimentary Zoom conversation. So people can learn a little bit about me. I can learn a little bit about you. And, I am very transparent, right? I want it to be a great partnership. And if it's not, if I think there's someone who's a better fit for your needs, I will let you know and direct you to that person. And then, for people who do want to schedule that complimentary consultation, they can do it at wellempowered.com. But, at that point, after, we talk, if it does seem like a good fit, first we start with two 90-minute conversations. And in that first 90-minute conversation, that's when I'm doing all this. I think about it like putting on my detective cap and start looking around for the puzzle pieces and the missing puzzle pieces. And then we gather them in that first appointment, between the two appointments, between labs and tracking and all the other good information that we're putting together. And then in the second conversation, we talk about it all, and we look at what we found out. And then from there, we talk about what would it look like to take this and translate it into, fulfilling your vision of vitality. And a great quote I've heard is, knowledge is effective action, right? It's one thing to have information. Information is facts. Information's information. But knowledge is when you've taken it and created actions such that you have outcomes, and done that consistently enough that you're really confident, right? You have wisdom.
Good. I love it. And I think Americans are famous for paying the most for accountability, right? And that's what you can have all the labs, all the things staring you in the face that, I'm sure we'll have technology that says your lifespan is this long if you don't change anything. You could have something as serious as that. But if you don't have someone on your side, not just poking you with a stick, but continuing to remind you, not just of how you can feel, but your value and your purpose, and to keep going. And that's what I think, someone like you has not the only value, but the main value, where it's you have this person in your ear that's continuing to show you your worth and to show you that you're valuable, and that can come alongside you with the data and your answers and say, this is what you wanted, this is where you're at, let's go, like let's continue to push. And so I highly recommend, if you're someone that is stuck in the loop of weight loss, you've seen other people and haven't got results, most likely you need someone that is willing to take the time to dig deep and to hold you accountable, because it is a process. Even though it didn't feel like it took years to get this way. So it's going to take time to teach your body to live somewhere new. So if you're listening and that's you, go ahead and book a call with Dr. H, and I think it'll be an amazing conversation for you. Dr. H, thank you so much for joining me. This has been an amazing conversation. I can't wait for people to listen to it. Any closing thoughts or closing words that you'd like to give?
Oh my goodness. Thank you so much, Dr. Chris. It's been such a treat to be with you. For me, Well Empowered, my mission is people bringing their gift fully to the world and inspiring others to do the same. And I know you get that and in what you do. And, my wish and hope is for everyone in your audience to really create the level of health and vitality you need in order to fully author your life, to fully bring your gift to the world and inspire others to do the same.
I love it. Because you can have all the money in the world, but if you don't have your health, you can't do anything with it. So prioritize that. Well, I look forward to this episode coming out. I look forward to continuing to follow your journey, and I'm jealous of you being in Switzerland. Hopefully I'll get to visit one day.
Absolutely.
And we'll talk to you soon.
I've got some great hiking trails charted out, so anytime.
Perfect. Thank you so much.
Thanks so much, Dr. Chris.